Welcome back to Blocking the Fame, Anakinra and COVID. I'm Gaganasri, your host, biologist by training and bioinformatician by passion. Today's episode feels like coming full circle. We are looking ahead toward the horizon of innovation with next-gen IL-1 modulators and their role in post-viral syndromes like long COVID. Joining me is Aseema, whose microbiology background is grounded in the molecular symphony of host pathogen interactions and whose passion for the gut brain axis makes her uniquely positioned to speak on long term immune dysregulation. Aseema, it's an honor to have you here for the final episode.
Thank you so much, Gaganasri. It's been a true pleasure to be here and to be a part of this series. And the intersection of immunology, virology, and chronic symptomatology, especially in post viral contexts like long COVID, is such an important frontier right now. And I'm excited to unpack where IL-1 modulation is headed and what that might mean for patient care in the coming years.
We often imagine cytokines like instruments in a chaotic orchestra. When finely tuned, they help us recover, but when overactive, they create a storm. But IL-1 in particular seems to be playing the first violin in that storm. Can you walk us through why IL-1 has become such a key target for managing these post-viral syndromes?
Well, yeah, absolutely. So, IL-1, both alpha as well as beta isoforms, function as a master conductor in the acute inflammation. In COVID 19, we have seen that overactivation of this cytokine can lead to a cascade of downstream effects from endothelial dysfunction to neuroinflammation. What's particularly relevant for post viral syndromes is IL-1's role in maintaining a state of low grade chronic inflammation. That persistent immune activation, where the body behaves as if it's still fighting an infection, is thought to underlie many symptoms of long COVID, that is, fatigue, cognitive fog, muscle pain, and even dysautonomia. The challenge now is to distinguish between protective versus pathological IL-1 signaling. If we can refine how we modulate this cytokine, we might not just suppress inflammation, we might recalibrate the immune system altogether.
That metaphor of recalibration really resonates, especially when you think of the immune system as a finely tuned network. So let's peer into the future. How are researchers thinking about designing the next generation of IL-1 modulators?
Well, the direction is clearly toward precision and sustainability. Let me outline a few promising approaches. One is monoclonal antibodies. We are seeing increasing development of antibodies that specifically block either IL-1 alpha or IL-1 beta. These could provide longer lasting effects and high specificity compared to Anakinra, reducing the frequency of dosing, especially valuable for chronic management. Then there are oral IL-1 inhibitors. A major leap would be oral bioavailability. Small molecule inhibitors that disrupt IL-1 receptor signaling without injections could drastically improve adherence, especially in outpatient care settings. There's also multi-cytokine blockers. Because long COVID isn't driven solely by IL-1, there's growing interest in designing therapeutics that simultaneously inhibit IL-1, IL-6, and TNF alpha. These agents might better address the multifactorial nature of post-viral syndromes. Lastly, gene editing and epigenetic modulation. Though still nascent, tools like CRISPR and siRNA offer a glimpse into durable, perhaps even curative interventions. Imagine being able to program dysregulated immune memory after a viral infection. That could transform not just COVID recovery, but our broader approach to chronic inflammation.
Wow, those sound like the biotech equivalent of going from a bicycle to a spacecraft. But even the most elegant drug won't work without the right map. In a condition as variable as long COVID, how do we tailor these tools to the right patients?
Well, that's really where things get exciting as well as complex. Personalized IL-1 modulation requires a layered understanding of each patient's immune status. We are beginning to use biomarkers like CRP, IL-1 beta levels, ferritin, and even neurofilament light chain to classify patients. In tandem, genetic profiling can help identify polymorphisms in inflammasome related genes such as NLRP3 that may predispose someone to exaggerated IL-1 responses. Then there's the gut brain axis, an area I'm especially passionate about. Post viral changes in the microbiome can alter peripheral immune tone and influence neuroinflammation. So, integrating microbiome sequencing into the diagnostic toolkit could further refine how we choose therapies. Ultimately, the future lies in building immune fingerprints for each patient. Think of it as a molecular passport tells us which cytokine pathways are overactive and which therapies to prioritize.
Immune fingerprints. I love that. It's like giving every patient their own personalized immunological soundtrack.
Yeah.
Looking at the bigger picture, what excites you the most about the potential of IL-1 modulation?
Well, what excites me is the opportunity to shift from reactive to proactive medicine. Instead of merely suppressing flare ups, IL-1 modulation could allow us to prevent long term sequelae. For example, in patients showing early signs of neuroinflammation, timely IL-1 blockade might reduce the risk of developing neurodegenerative symptoms. Or in patients with endothelial damage, early intervention could prevent cardiovascular complications. It also has the potential to be integrated with non-pharmacological strategies like diet, sleep, or neurorehabilitation. The synergy of holistic care with immune targeted precision drugs could redefine how we treat chronic disease. Yeah, so it's about moving from managing illness to restoring resilience.
That's a powerful vision, Azima. As we close this series and also this episode, what would you say to fellow scientists and clinicians exploring the future of IL-1 targeting?
Well, I'd say keep following the trail of inflammation, but do not forget to listen to the body's whispers before, they become screams. The more we understand the immune system's nuances, the more equipped we will be to design interventions that are not just suppressive but restorative as well. Collaboration between immunologists, neurologists, and microbiome researchers and patient communities as well will be a key. And long COVID is a new challenge, but it's also an opportunity to reimagine how we think about chronic illnesses.
That's a beautiful way to end. Thank you, Asima, not just for this episode, but for your insights across this series. Your depth of knowledge and empathy for patients have truly enriched these conversations.
Thank you so much, Gaganasri. It's been a true honor to be a part of this journey.
And to our listeners, thank you for tuning in to Blocking the Flame, Anakinra and COVID. As we sign off, remember, the immune system is not just a battlefield, it's also a healing garden. With research, resilience, and relentless curiosity, we can nurture it back to balance. Stay safe and stay curious. Keep asking the big questions. Until next time.